Good morning, everyone, and thank you for taking the time to join us here for this media briefing. We're going to be giving an update on respiratory viruses in Colorado. A couple of housekeeping items up top. We do have a couple of interpretation options available. Our American Sign Language interpreters will be spotlighted throughout this briefing, and our Spanish interpretation channel is available with that interpretation globe control along the edge of your Zoom console. You can also use that gray slider bar in the middle of your Zoom console to customize your viewing experience based on presenters and the slide deck and what you're looking for. So we can go to the next slide, and I'd like to introduce you to our presenters for today. Dr. Rachel Herlihy, our state epidemiologist at CDPHE. We're joined by Dr. Kevin Carney, Associate Chief Medical Officer at Children's Hospital, Colorado, and Director Scott Bookman of the Division of Disease Control and Public Health Response. So I'm going to kick it over to Dr. Herlihy to get things started.
Good morning. Thank you so much for joining us today. We are seeing signs of an increasingly challenging respiratory virus season, and so I want to provide you with an update on the data that we are seeing and tracking here at CDPHE. So I'm going to talk you through the data that we're seeing for RSV, and we'll talk more about the details of this virus. We'll talk about COVID.
Recording in progress.
So starting with RSV, I think the population has become much more familiar with COVID over the last 2.5 years, and I think people are very also comfortable in understanding influenza, but I think people are a little less familiar with RSV or respiratory syncytial virus. So I want to spend just a minute to make sure we're all on the same page and understand this virus. So RSV is a respiratory virus similar to flu and COVID that usually causes mild cold-like symptoms. And those symptoms are similar to what we see with other respiratory viruses, things like runny nose, decrease in appetite, coughing, sneezing, fever, wheezing. But RSV can also be serious, and that is true especially for infants and young children below the age of 2, and for older adults, people over the age of 65, or people with underlying medical conditions like heart and lung conditions. Next slide, please. And so here in Colorado, we are seeing an increase in the number of hospitalizations and outbreaks due to RSV. And for really the last couple of weeks, we've been at pretty high levels, unprecedented levels of RSV transmission. Right now, we have 554 hospitalizations that have been reported, specifically in the Metro Denver area. Colorado is one of 12 states that tracks RSV hospitalizations as part of a CDC program known as the Emerging Infections Program. And that program looks specifically at hospitalizations in the Denver metro area, not statewide. But statewide, we do track outbreaks due to RSV, and you'll see that we have 144 outbreaks that have occurred since the beginning of October. If you look at those hospitalization numbers, you'll see that the vast majority of them, 525 of the 554, are among pediatric populations, with a smaller proportion of them occurring among our adult population. Next slide, please. Similar to what we've become used to looking at for COVID transmission, we also track laboratory percent positivity for RSV and also for influenza. So this is the data showing you the RSV positivity value. You'll see that since the beginning of October, we've seen a really rapid increase in that value, again, suggesting increasing rates of transmission of the RSV virus. Next slide, please. Turning to hospitalization data, and this is hospitalization data for all age groups, so combining pediatric and adult hospitalization age-specific data, and comparing the data shown in the purple line for our current season to previous seasons. And so what stands out in this figure is one, that the level of RSV hospitalizations that we're seeing right now are very high. It's earlier than usual to see levels of hospitalizations this high, and also much higher than we typically see. So a pretty unusual and severe RSV season that we're experiencing currently. Next slide, please. So turning specifically to our pediatric population, where we know the majority of those hospitalizations are occurring. Again, you can see with that green line, our current season, the 22-23 season, and then recent historic seasons to compare that value to. So again, very high levels of RSV transmission resulting in hospitalizations right now and earlier than usual. One of the things that you will notice, if you look at the red line last season, you'll see that we saw this increasing number of hospitalizations that occurred last year, starting in the summer and leading into the fall. But you'll also see that what we're experiencing now is much larger than what we experienced last season. And so what's unusual and what seems to have been disrupted by the pandemic is the timing of RSV season. So again, unusually high levels early in the season compared to, if you look at that 2019-20 season, that's more typical of what we see for RSV, where the peak level of transmission is later into the fall and winter. Next slide, please. So again, some more specific data on our pediatric population and hospitalization numbers and rates. So this table is showing you age-specific numbers of hospitalizations that have occurred in the Denver metro area and the overall hospitalization rate, allowing us to see which age groups are most severely impacted right now. And what you'll see is that our youngest age groups are the age groups where we see the highest hospitalization rate. And then as children get older, you'll see that those hospitalization rates decrease from our youngest to our oldest population. Next slide, please. And then comparing pediatric hospitalizations due to RSV to hospitalizations due to flu and COVID right now, you'll see that really the virus that is impacting our children most right now is that RSV virus. And so that is the virus that is resulting in the most hospitalizations among our pediatric population and putting strain on our pediatric healthcare system across the state and also across the country. Next slide, please. Next slide. And so while we're seeing the virus that's circulating at highest levels right now and causing the most hospitalizations right now is RSV, we are also seeing worrisome trends when it comes to COVID and influenza. So turning to COVID data, here specifically you see that our COVID case numbers are increasing over time. Keep in mind that case numbers now are not the same as what they were previously because of changes in testing practices, but the short-term trends are reliable and are something that we can look at to see whether or not we're seeing a change in trends. And so here you can see an increasing trend in the number of cases that we're seeing. And this increasing trend shows up in most of our indicators, and I'll show you the next couple of slides. Next slide, please. So again, similar to our case data where we're seeing an increased number of cases, we're also seeing our percent positivity value increase. You can see a very steep increase in the proportion of tests for COVID-19 that are coming back positive over the last couple of weeks. Again, another indicator that COVID-19 transmission is increasing here in Colorado. Next slide, please. And then the same thing goes for hospitalization numbers. Our hospitalizations as of today or as of yesterday were 320 hospitalizations in the state, and that is up from 218 just a week ago. So pretty dramatic increase in COVID-19 hospitalizations as well. Next slide, please. And we believe that at least a part of this increase in transmission of COVID-19 is being driven by new subvariants. We know that as we get further into the fall, people move indoors, and that certainly could be increasing transmission. But we also know that there are a number of these new Omicron subvariants that are emerging and have some concerning characteristics that make them more transmissible or more likely to escape our immune response from previous infection or vaccination. And so what you see here is that over time, the predominant variant the last couple of weeks has been this BA.5 Omicron subvariant. But you'll see that that proportion of viruses that are being transmitted in the state due to that subvariant are shrinking over time and are being replaced by some of these newer subvariants with those concerning characteristics. So the ones that stand out are BQ1.1, BQ1, BF7, and BA5.26. Next slide, please. All right, turning to influenza. So similar to COVID, we are now seeing a clear increase in the amount of influenza transmission that's occurring here in Colorado. As of this week, we've had 92 hospitalizations, and that's an increase from 49 last week. So we have seen a bit of a steeper increase in the number of hospitalizations occurring due to influenza in the state. Smaller numbers than what we're seeing with RSV, of course, and that holds true for outbreaks as well, with just 3 outbreaks reported so far in the state due to influenza, but again, increasing trends overall. Next slide, please. So again, looking at percent positivity data for influenza, you can see a really rapid increase in the percent positivity value for influenza A. Just a reminder that influenza really includes multiple viruses. There are multiple influenza A and B viruses that we're tracking. And you'll see if you look at that orange line, which shows you the influenza B percent positivity value, that continues to be low. So the vast majority of what we are seeing transmitted in the state right now is influenza A, and a very steep increase in the percent positivity value for influenza A. Again, increasing transmission is indicated by this data. Next slide, please. And then turning to hospitalization data for influenza, if you look at the red line here, that shows you our influenza-associated hospitalizations in the state and comparing that data for this season to previous seasons. So if you look at that red line, you'll see that overall hospitalization numbers are still relatively low compared to peak influenza levels. But you will see that we are actually now ahead of our most severe season on record, which is that 2017-2018 influenza season. And difficult to know what the trajectory of influenza-associated hospitalizations is going to be in the weeks to come, but certainly concerning to see that the level of hospitalizations we're seeing now is ahead of that severe 2017-18 season. Next slide, please. So turning to prevention strategies. So we know that there are a number of things that we can do to prevent transmission of respiratory viruses. Obviously, most important is going to be vaccination. We know that vaccination is the best strategy to prevent influenza and COVID-19 infections, especially severe infections. The flu and COVID vaccines are effective and safe vaccines, and anyone 6 months and older can get vaccinated for flu and COVID-19. Of course, important to remember that you can get both your influenza vaccine and a COVID vaccine, including the new Omicron dose at the same visit. Encouraging people to stay home when they are sick is critically important. I think that people often misunderstand that a mild illness that they might have, something that feels like a cold, that exact same virus can go on to cause severe illness in someone else. So a mild infection in me or you can translate to a life-threatening infection in a young child or an older adult. So again, especially important to stay home and not visit individuals who might be at greater risk of severe disease, including immunocompromised people, older adults, young children, and infants. Other things that we've learned in the last 2.5 years that can prevent transmission of respiratory viruses include things like frequent hand washing and proper hand hygiene techniques. So washing your hands regularly with soap and water for at least 20 seconds or using alcohol-based hand sanitizer. Next slide, please. Other strategies, of course, include covering your cough or your sneeze with a tissue or into your elbow as another good way to prevent those germs from spreading from person to person, cleaning potentially contaminated surfaces like doorknobs, tables, handrails, things that are touched frequently, and then things like avoiding sharing cups and eating utensils. Also important is to avoid touching your face with unwashed hands. We know that touching our face is a way that we can introduce virus into our body, and also if we are ill, potentially contaminate surfaces that other people will go on to touch then and then become ill themselves. Next slide, please. With that, I'd like to hand it over to Dr. Carney.
Hi, thanks very much, Dr. Hurley, and thank you all very much for the opportunity to be here and speak with you. Again, my name is Dr. Kevin Carney. I'm a pediatric emergency medicine physician and the Associate Chief Medical Officer at Children's Hospital Colorado. So kind of to put this into context, I want to kind of share with you what's going on here at Children's and just reiterate everything that Dr. Hurley talked about, particularly as it relates to RSV. To put it mildly, we are seeing a very early and intense start to both the RSV and flu seasons, and our emergency departments and inpatient units are really managing patient volumes like we've never seen before. This volume surge began in mid-August when we saw a significant spike of rhinoviruses and enteroviruses as children returned to school. Fortunately, those viruses have largely receded, but we're now in the middle of a very early and severe RSV season, leading to huge numbers of children and families seeking our help. As Dr. Hurley mentioned, RSV is a well-known leading cause of respiratory illnesses in children and adults. And as she mentioned, in adults, it often causes nothing more than a cold. However, it can be much more serious in children and is often most severe in babies under 1 year of age. It's in fact the most common cause of a pediatric condition called bronchiolitis, a condition in which children may develop, as she mentioned, a harsh cough, wheezing, difficulty breathing, and sometimes decreased oxygen levels. Fortunately, most children with RSV bronchiolitis do not need to be admitted to the hospital, but for those that do, they often need oxygen support, frequent suctioning to help keep their airways clear, and hydration support. And indeed, some children do become sick enough that they need to be admitted to intensive care units for increased respiratory support. So first, it's important to know that we are in pediatrics very used to treating children with bronchiolitis, and we're used to managing increased patient volumes during a normal respiratory season, which historically is between January to March. What's different this year is how early and severe this respiratory season has been for the children in our community. And it's truly like nothing we've ever seen before at Children's Hospital of Colorado. Our inpatient floors and intensive care units have been functioning at or above their maximum capacity for several weeks, and our emergency departments are seeing a record volume of patients. In fact, the number of patients seeking care in our emergency departments on a daily basis has been on average 30% higher than even the busiest of days in previous respiratory seasons. I do want to stress that while we're experiencing higher volumes than we've ever seen, our team members are working tirelessly to ensure every patient is treated with the best possible care. So we've responded by implementing our normal surge tactics and additional measures to accommodate the influx of patients coming to the hospital. We've reallocated beds and we've expanded inpatient care areas across our system. We've engaged additional contract team members, including travel nurses and respiratory therapists, who can assist with the surge of patients across our system. And while we always try to avoid doing so, we have had to postpone some non-urgent surgeries and procedures for children.